Hi. This evening, a concerning story. The untimely death of several celebrities like Siddhant Veer Suryavanshi, Puneet Rajkumar, RJ Rachna, Siddharth Shukla, and KK, all under the age of 50, has highlighted the increasing incidence of heart attacks in seemingly fit and young middle aged people. It is usually thought of something that happens to older people in their 60s, 70s, and beyond. Before I go further, I want to add a disclaimer. This video is not meant to serve as medical advice, nor are we qualified to give you medical advice. Please consult a general physician or a cardiologist based on your needs. Some newsworthy data points to set the context. The Indian Heart Association estimates that Indians tend to suffer from heart disease almost 33% earlier than other demographics. 50% of all heart attacks in Indian men occur under the age of 50 and 25% in men under the age of 40. And while global statistics indicate that the instances of cardiovascular diseases are declining among women, in India there has been a 3% increase in heart attacks in women from 1990 to 2019. So what exactly is happening here? Studies show that Indians have a higher predisposition to heart disease and develop the ailment about 10 years before their global counterparts. If one has a family history of heart disease or diabetes or hypertension, they are at a higher risk. Other risk factors for a heart attack are well known, but they're worth repeating given that once applied mostly to older people, some are increasingly applicable to the young. Premature diabetes and obesity makes people more prone to suffering a heart attack. Indians tend to consume a lot of trans fats, which causes an increase in bad cholesterol, which can also lead to heart disease. The next risk factor is something you may know about: smoking. It leads to the constriction of blood vessels through the buildup of plaque in the arteries and causes your blood to thicken, which can put smokers at a high risk of heart disease and heart attacks. Drinking too much alcohol is also on this list. Stress leads to an increase in inflammation throughout the body, which can cause high blood pressure and lower good cholesterol levels, causing harm to the heart. Stress can also affect the heart indirectly. When you're stressed, you tend to sleep poorly, exercise less, eat less healthy, or watch your weight. 2 years of a global pandemic, recession, mass layoffs, safe to say things have gotten more stressful. Let's take a deeper look at how COVID-19 is playing a role in increasing heart attacks among the young, besides adding to general stress levels. Sedentary lifestyle, not being active for at least 30 minutes a day, can put one at a higher risk of heart-related ailments. It's safe to say that activity levels have declined since 2020, with lockdowns literally restricting our movements to inside our homes. And people are continuing to live more sedentary lives even though avenues for physical activities have now opened up. There are some reports that suggest that over-exercising can also lead to heart attacks, especially since some of the recent deaths happened during or after intensive workout sessions. Here's what we do know about that. An excess of anything is bad. But there is currently no significant data to suggest that overdoing it at the gym can cause a cardiac event. Overall, there are many more studies that show that exercise prolongs life and reduces the risk of cardiac issues. That being said, please take guidance from trainers, nutritionists, and doctors before taking on any extreme workout and diet changes. Decreased doctor consultations and self-medication during COVID-19 lockdowns have also played a role in the increase in heart attacks. And there is now enough evidence of the long-term consequences of infection and reinfection from the virus. Some autopsy studies have shown that viral particles in the heart weakened and inflamed the heart muscle in patients that saw heart failure. Doctors have also hypothesized, based on the increase in heart attacks since 2020, that COVID-19 can cause blood clots in small vessels of various body organs, including the heart. Doctors and researchers across the world, including India, and the US, EU, China, and the UK have documented an increase in sudden deaths from heart attacks and strokes among young people who were hospitalized when they got COVID-19, but also those who only had mild COVID-19. In India, fatalities due to heart attacks are also a result of negligence. In most cases of heart attacks, if medical help is not provided within 60 minutes, it can lead to death. So, knowing what it feels like and what to do is crucial. There is this pop culture based myth that a heart attack only feels like a particular kind of pain in the left arm or a constriction in the chest. The fact is, discomfort from the jaw to the navel can signal a heart attack. So can sweating more than usual, a feeling of acid reflux, swelling of limbs, gas or indigestion, feeling tired for no reason, or nauseous and getting the chills. These are all symptoms that men experience more than women. In fact, the story of heart disease in women is a whole other ballgame. Heart disease is seen as a man's disease. There is no two ways to say that. There is a medical bias, a documented medical bias, which leads to doctors testing women less frequently for blockages. They are less likely to present with classic symptoms of heart disease, which means they may go undiagnosed. And when women do have heart attacks, the symptoms present differently. These include feeling weak or nauseous, vomiting, feeling pressure on the chest, which may sustain or come and go, feeling dizzy, back pain, and throat discomfort. Back pain. How many women feel that and think about having a heart attack? It's important to know these symptoms and also what to do if you or your loved ones experience them. Call for emergency medical help immediately. It's unsafe to drive yourself to the hospital during a heart attack, so call an ambulance even if you feel awake and alert enough to drive. Keep a list of medications you currently take or any information about your medical history handy. Doctors and paramedics need this information, and having it ready will speed up your medical care. In case someone around you goes into cardiac arrest, which is different from a heart attack, and becomes unconscious, perform CPR on them and call an ambulance. Do not perform CPR on a conscious person having a heart attack, though. And finally, ways to prevent being in this situation as much as you can. You know it. Eat a balanced diet, exercise for 30 to 45 minutes daily, get 7 to 8 hours of deep sleep every day. Manage your stress through a method of choice. Having a work-life balance, a hobby, meditation, aromatherapy, there's no dearth of options. Quit smoking if you do. Manage your weight. And finally, get regular heart-related tests done from your 30s onwards, at least once every 2 years, doctors recommend. I'll stop here. This video is 100% in public interest. Please share it with your loved ones, on your social media feeds and WhatsApp groups, and tell them you care about their heart. And before I go, consider making a monetary contribution to Newsworthy so we can keep doing stories in public interest, stories worth your time and attention. I'll leave a link to Razorpay in the caption of this video on YouTube. The link is also there on our Instagram bio. If you've been watching, thank you so much for your time today.